One of the greatest things about Healthy Heart Clinics is that we are completely integrating our CardioCARE program. Our CardioCARE program came out of preventive care understanding and monitoring of every single patient. So CardioCARE is that arm around the patient that's really trying to understand what's going on. So there's a technology element that's kind of based on how do we do all of this. So first, we're going to understand by doing a risk assessment or an annual wellness visit to determine what your needs are. It might determine your levels, whether that's your calcium levels or whether that is your hypertension or whether that is your COPD challenges or your cholesterol or your diabetes. Coming to Healthy Heart Clinics and getting access to CardioCARE is a significant impact in that personal care or that personal treatment. In addition to the technology platform that's supporting the care, we're using that as the way to monitor your vitals. So whether you're stepping on the weight scale, putting your arm in a blood pressure cuff, or putting your finger in a pulse ox, the ability to get that information and have it monitored and analyzed to make sure your vitals are staying within range. A lot of times people go on with their day-to-day activities and don't even realize that their blood pressure has skyrocketed. And for us, the ability to watch a patient and say, hey, look, we're noticing some out of ranges here on your blood pressure. Maybe we need to make a change or at least understand what's going on. So the vitals give us an ability to analyze your standards, your levels, to ensure that somebody is looking out for you when you're going on in your day-to-day activities. Somebody within your four walls at your house is now looking out for your best interests of your care. And that's CardioCARE. CardioCARE comprises a care team, a care management program that includes your concierge level service. So you're going to get a clinical coordinator. That clinical coordinator may be a nurse or may be a medical assistant, but is completely in your court, meaning that person is looking out for your interests based upon understanding your needs. So now you really have somebody that you can count on or call on. In addition to that, over and above that initial care coordinator are going to be a team of experts, whether that's specialists or medical providers, or whether that's research, whether that's a dietitian or a nutritionist. They're overlooking the overall program to ensure that that patient is getting the best quality of care that's intended for them. So CardioCARE is an extension of our clinics. CardioCARE is much more to the specialists in the industry, such as cardiologists or internists or other, where they can see us and we can take care of their patients between their office visits to keep them at their optimal levels or the healthiest that we can help with that patient to be. Once we do that initial test or screening, we can determine your health score based upon either your diabetes levels or your cholesterol levels or your hypertension, kind of where your average or your blood pressure might be. And then we're creating a score that gives you the ability to have an average. If the average is in the red zone, well then now you know there's something to pay attention to. If your average number is in the yellow zone, well then there's some caution that we are taking or helping, or maybe we can improve to help you to reach your goals. If it's in the green zone, you're probably doing okay, so let's keep that up. That's the preventive aspect of it. So quality of life comes out of knowing your score. So knowing your numbers helps you to understand what you need to do and helps you to know your future. Know your numbers, know your future. And you can do that with CardioCARE. You can get CardioCARE from any one of the Healthy Heart Clinics in the country. We're based throughout Louisiana and Georgia, opening in Texas and other states to follow. Coming to a Healthy Heart Clinics, ask about CardioCARE. Let's get on the program. That individual patient can truly be taken care of. That's what I want to see. I want to see the world change towards the real, true patient-centered care. We want to direct it to that patient to ensure we got you. We're able to help you. We're listening. We're paying attention. We're treating you for what your needs are.